हम कई दूसरे देशों के नागरिकों को भी वहां से वापस भेजा हमारी उत्पादन क्षमता पूरी मानवता के हित में काम आए।
Mantap bisa. ꯂꯥꯞꯅꯕꯁꯨ ꯌꯥꯗꯕ
Welcome to the chief guest of today's event, Sir Shri Nongthombam Biren Singh, who is the Chief Minister of Manipur, who is also serving as the President of our JENIMS Society. We also extend our welcome to the President of today's event, Sir Dr. Sapam Ranjan Singh, Honorable MLA, Advisor Health to the Chief Minister of Manipur. Thank you, sir. We welcome the guest of honor of today's event, Sir Dr. Rajesh Kumar, Chief Secretary Government of Manipur, for taking up the chair, sir. We would like to also extend our welcome to the Additional Chief Secretary of Manipur, Sir Paulunthang Waifai, sir, for being with us today, sir. Now to formally commence today's event, I firstly, Aroibada Akhigi JENIMS ki Director Oina Pubiriba Sir Dr. Thongam Bhimo Singhbu Daesta Lengkhat Piraknaba Ningsingjari. Thank you, sir. I would like to also call up on stage the Director of Manipur Health Services, Dr. K. Rajo Singh. Thank you, sir. Next, I welcome Director Family Health and Welfare, Dr. P. Shyam Sundar Singh. Thank you. Next, I would like to welcome Dr. N. Shyamjai Singh, Director State Mission, Manipur State Mission Director, to please take up the seat on the dais. Thank you, sir. Welcome. Okay. A very good morning to everyone. I, on behalf of the entire JENIMS family, would like to extend a gracious welcome to you all. This beautiful morning today has brought within its purview a flawless mood of positivity and a shimmering will to fight against all odds. It is a very special and important event that we are celebrating today as we participate in this historic nationwide vaccine rollout under the capable leadership of our Chief Minister Shri Nongthombam Biren Singh. Thank you, sir. Keeping up this mood, I would like to extend our heartiest welcome by presenting a humble presentation in the form of a Lingyan P to the chief guest of today's event, Sir Shri Nongthombam Biren Singh, who is also the president of our JENIMS Society. Volunteers Singbu Ningsingjari. Next, we would also extend our welcome to the President of today's event, Sir Dr. Sapam Ranjan Singh, Honorable MLA and Health Advisor to the Chief Minister of Manipur. We would also like to welcome our guest of honor of today's event, Sir Dr. Rajesh Kumar, Chief Secretary, Government of Manipur. Thank you, sir, for gracing us. Next, we extend our heartiest welcome to the Additional Chief Secretary, Government of Manipur, Sir Paulunthang Vaifai, and also to the Director of JENIMS, Sir T.H. Bhimo Singh. Thank you. I also would like to take particular note of the presence of all the guests, faculties, nursing staffs, and all our dear students who have taken out their precious time to make this event a successful one. Thank you, everyone. Now, I would like to request our guest of honor, Sir Paulunthang Vaifai, sir, Additional Chief Secretary, Government of Manipur, to please deliver the welcome address. Please, sir. Vaccine launch.
On this very historic launch of the COVID-19 vaccination Manipur chapter this morning at JENIMS Auditorium, Porompat, IMPHAL East, which is being followed just after the historic launch by the Honorable Prime Minister of India, which we were joining over video conference just now. It is my privilege to welcome Sri N. Biren Singh, Honorable Chief Minister, Manipur, who is also the Minister in charge of Health and Family Welfare for the state of Manipur, as chief guest to this vaccination program. It is also my privilege to welcome Dr. Sapam Ranjan, Honorable MLA and Advisor to Chief Minister in this health sector. My sincere and gracious welcome to our respected Chief Secretary, Dr. Rajesh Kumar, who has been guiding us for quite some time now in the fight against COVID. My warm welcome to the officers of the Directorate of Health and Family Welfare, the Director, JENIMS, faculty members, all dignitaries present, as well as very important key members of the healthcare workers and the medical community this morning. As you all know, as the Honorable Prime Minister just announced, the vaccine drive which we are going to launch today, which has just been launched by the Honorable Prime Minister, is the largest in the world. The good thing about this launch is it is covering the entire country, length and breadth of the country. And in Manipur also, we are covering the erstwhile 9 districts as well as IMPHAL, over 10 selected sites, with one of the selected sites having two-way conference facilities. Certain doubts have been raised, unfortunately, in the media, social media more particularly, but rest assured, the voluntary and the way the medical community led by the learned doctors, distinguished doctors, who are the most aware about healthcare, the way they are coming forward is a very encouraging step. I have said this in my previous interface with the media, that there has been very warm, very strong reception from the medical colleges and the doctors community. In fact, till late evening yesterday, many of the doctors were still working to find out as to whether the people who have been listed for the 100th vaccination today are physically in a position to take the vaccine or not. Because the vaccine cannot be given to certain medical condition people like lactating mothers, pregnant women, or people having some medical conditions. if there be any percentage which do not come up to 100%, I would sincerely appeal to the media community not to misinterpret it as lack of willingness. That could be primarily because of the physical or medical condition of the beneficiaries concerned. I would sincerely appeal to them to focus on the percentage achieved, to focus on the positive aspect of it, because this is a very, very big step, not just to save ourselves, but to save our loved and dear ones. COVID Seal, as you all know, is manufactured by Serum Institute of India, Pune, but the vaccine is not developed by Serum Institute. It is developed by the Oxford University in association with AstraZeneca, and it has undergone tremendous trials. Most of the doctors' communities I have interacted with, in fact 100% of them are comfortable with this vaccine. This is a very, very positive step which must be taken forward. We will be having tomorrow Sunday as a break where we will be reassessing the logistics of it. We will carry it forward thereafter from Monday. The good thing about it is, although Ministry of Health and Family Welfare has selected only 10 sites, Manipur is prepared to expand it up to 246 sites. We already have 2 walk-in coolers. We have 12 vaccine vans with provisions to outsource additional vaccine vans if required. We already have established 126 cold chain points. We already have covered the entire session sites through dry runs on 2nd and 8th of January. Few hiccups which have been detected have been resolved to a great extent, and we are very confident as a department to carry forward this largest vaccine drive. I sincerely appeal to the public of Manipur to wait patiently for your turn, because as per the protocol which have been developed, the healthcare workers who are fighting COVID on the face of it will be the first priority for coverage. The second will be the frontline workers. The third will be the people with 50 years plus age. Thereafter it will be minus 50 plus comorbidity. Then there will come our turn, including mine. So let us be very disciplined. 2-3 things which have been reiterated time and again just now by the Honorable Prime Minister is that, one, the first dose of the vaccine will be given today for these 100 people. It will carry on. The second dose will be 28 days after the first vaccine. The efficacy and the immunogenicity of the vaccine comes out after 14 days thereafter, which means 4 weeks plus 2 weeks, a total of 6 weeks. But even thereafter, the requirement to still follow COVID-appropriate behaviors, including frequent washing of hands, use of hand sanitizer, wearing of mask, and maintaining physical distance whenever you're among other people, these are still essential. Primarily because although you may be vaccinated, there may be others who have not been vaccinated. So it is always good to follow these guidelines. The other aspect is, in all the 10 selected sites as well as in the other prepared sites, 3 rooms are provided. One for the pre-vaccination for medical checkup of the beneficiaries. The second is for the actual vaccination room. The third is for the post-vaccination observation, which will be carried out over a minimum period of 30 minutes to ensure that the beneficiaries do not have any reaction. Due precautions have been taken to ensure that appropriate doctors with specialties of the area covered are stationed in all the selected sites. I am personally very confident that we will be able to carry this very successfully. Once again, I welcome all of you. I am so grateful to Honorable Chief Minister, who is personally looking after monitoring the entire vaccination drive. He had come, as you all know, to IMPHAL IMPHAL airport to personally receive the vaccine, the first consignment of the vaccine. This is the warm reception which has been accorded to the vaccine because of our eagerness to ensure the safety of our people in terms of COVID-19, and I think this is a very, very big message we all need to follow. With these few words, thank you so much.
Thank you for the delightful address, sir. I now request our Honorable Chief Minister, Sir Shri Nongthombam Biren Singh, to officially launch the Manipur chapter COVID vaccine rollout. CMO IMPHAL East, Dr. L. Indira Buning Singjari, COVID vaccine yauba box puputhok piraknaba. Thank you, sir. So we request you to kindly do the honor and officially launch the COVID vaccine rollout Manipur chapter. Thank you, sir. Vaccine asigi efficacy gi matungin sunlight amadi temperature control tawraga open tawba darkar leibana serbu injection room da linksin biraga first beneficiary vaccination tawba grace tawbina baningsing jari sir.
Hauzik Manipur gi ahan boina COVID vaccine kapna ba khoi patient da CM na direct oina doctor da CM na direct kusinar ba matung khoi gi ahan ba patient da kapna ba ready leire. Khoi Manipur gi han ba COVID vaccine kapna ba khoi gi patient hauzik ready leire. COVID vaccine ahan boy na kap kray Howsing ako ihan hanba COVID vaccine kap kraba ko patient hai bata ko hanba COVID vaccine kap kraba ko miyo dunia ko hojik mang do uri base ko mathang vaccine kap na be damak ta ko chief minister manung dam changkre Howsik ko Manipur chief minister Nongthamam Biren na howsik yeng biram liba mafam ado howsik ki miyoi COVID vaccine kap kraba matungda pungkhai man natraga pungama observation thamnaba room ni post vaccination lower ba matungda Howsik ako Manipur gi han boy na COVID vaccine phangrapa ako miyo dunia ko
미혼 조문에 관계 그때막 아이코이다 하이가다 거 마야마 말레리 아코이 adverse event following immunization na tinna semico akam pata
ngang dis romesh ko khangdi nungai ai nungai di ai gidra sibai kanbai di nungai du ga thaksa bogi ya de de nungai tre nungai ai ta ai nungai ai ta
kai sinpham honabige
ai sida attendee no ina leja
okay ado ngasagi vaccine kap ni se kana na ke
ngang dang phone dore
hoi hoi
ado mi tara hana ka ku ne da idi yaw do in sum lak da law da idi lak ba
hoi hoi
ꯑꯩꯅ ꯏꯍꯥꯟ ꯍꯥꯟꯅ ꯀꯥꯞꯄꯦ ꯍꯥꯏꯇꯥꯔꯦ
ꯑꯗꯣ ꯁꯤ ꯍꯥꯟꯅ ꯀꯥꯞꯄꯁꯤꯗ ꯀꯔꯤ ꯐꯥꯎꯕꯤꯒꯦ?
ꯀꯩꯁꯨ ꯐꯥꯎꯗꯦ, ꯅꯨꯡꯉꯥꯏ.
ꯅꯨꯡꯉꯥꯏꯌꯦꯕꯀꯣ.
ꯆꯤꯡꯅꯕ ꯀꯔꯤꯝ ꯂꯩꯇꯦ.
ꯍꯥꯟꯅ ꯅꯥꯕ ꯈꯣꯠꯄꯁꯨ ꯂꯩꯇꯦ.
ꯍꯥꯟꯅ ꯅꯥꯕ ꯀꯔꯤꯝ ꯂꯩꯇꯦ. ꯑꯩ ꯄꯨꯛ ꯈꯤꯇꯪ ꯅꯨꯡꯉꯥꯏꯇꯕ.
ꯆꯍꯤꯗꯤ ꯀꯌꯥ ꯁꯨꯕꯤꯔꯒꯦ?
ꯆꯍꯤꯁꯦ 50 ꯈꯔ ꯍꯦꯜꯂꯦ ꯍꯥꯏꯇꯥꯔꯦ. ꯈꯨꯔꯥꯏ ꯊꯧꯒꯥꯝ ꯂꯩꯀꯥꯏ.
Thank you, all the best.
그냥 떨어지.
제가 담배를 많이 희망합니다.
아니나.
Everybody, my colleague Mr. Waife has already elaborated about vaccination programs. I will not repeat that, but only request that the vaccine is safe. It's actually very, very safe. Some small problem, any injection related, you may have a local pain. It happens with any injection. It's an intramuscular injection. That's all I can say. Please wait for your turn. Every eligible person will get vaccine. The Honorable Prime Minister is very focused in creating and scaling it up. First to test 3 crore, then 30 crore, then everybody else. The state and nation will fight COVID successfully. I wish you all the best. Thank you so much.
Thank you, sir. Next, I would like to request the president of today's event, Sir Dr. Sapam Ranjan Singh, Honorable MLA and Advisor Health to the Chief Minister of Manipur, to please deliver a few thoughts.
Ngasi historic launch of COVID-19 vaccination. India gi oina Honorable Prime Minister na launch tawraba matungda sige vaccination drive si Manipur chapter gi Honorable Chief Minister na Manipur chapter launched to Bikre. Yamna nungaiba, yamna historical oiba. Functions the Chief Guest oibiriba. Honorable Chief Minister Shri N. Biren Singh. Guests of honor. Chief Secretary, Additional Chief Secretary, Directors of the health institutions, the faculty members of JENIMS, students, staff, friends from the media, ladies and gentlemen. Ngasi vaccination drive si Pitribigi oina world's largest vaccination drive ni, and a very, very challenging one. Ingsok lising aniga kunda koi kwai pum na magna hojika Chief Secretary nil thambikre Manipur da kamaina what are the steps that we take. What are the responsibilities that were taken under the supervision of the Honorable Chief Minister? India ki jagada haunading aida Manipur da ekoina logiba steps kya Akoi yamna mayek sengna thambigre. And luckily, the number of COVID-19 cases is very much on the decline. Yes, we did lose many lives. One life that was lost was very precious to us. However much we tried, by all of us, the teamwork that we had, we could not save many lives. That's simatangdi akhoi khwai pumna yamna nuai taba thawdokni. It's a global phenomenon that we all had to face together. We had a team from every section of the society, and now another vaccination drive. See, it is not an easy thing. We all know that. It's a teamwork that we need to. Vaccine anyone who has got himself vaccinated today, positive, are we going to say that the vaccine is ineffective? No. Honorable Prime Minister, we are make efficiency, efficacy, it will only come after the second dose to 14 days, to approximately 45 days to vaccine effective social media, it's all about negative comments, negativity is positive it's all negative. Let's leave them. Vaccination drives effective. See, media personal yaubiri but kwaipom na manglazo sige wakalon je spread tong minaba. Efficacy proven torabani, safety proven torabani. Adunabo nasige vaccination drive, world's largest vaccination drive ni. Duga akoigi khwaidigi nuaiba mana Honorable Prime Minister na Adom Lauduna have been shouting, has been with a very committed mind, make in India, and it's a Adagi can Otokudo. Nasidi, own, make in India vaccine, say Honorable Prime Minister, make in India and vaccine. So Magi vision, Magi commitment, Mana Kaljaruba, Ate Hana, COVID, Lakani, COVID, Habalina, Lakani, have a country matam dudagi, make in India, promote Tonabata City. Make in India magi vision dugi makada. Make in India two vaccines that are made in India. Akoida was a kapa pangaba matungzida. I'm sure this will protect all of us in the future when all of us get the vaccine. Aduna yamna sanga zungangzer luga post vaccination amukahanai reiterate tawzarizini. We need to know that the effect of the vaccine will just not start just after you have the first dose. I don't know, this we need to tell the people, we need to let the people know, we need to spread word by mouth through the media, through the pamphlets or whatever thing. Otherwise, again, negative, we need to change that mindset. Vaccines, it's a mammoth task. Population loina cover the healthcare workers at the Ahanba phase, then the frontline workers, 50 years and above, below with comorbid conditions. Sige mayamji loina dum to kani hadan hojikto dum haibikre aduna let's pray akoi shoda isha sana thazabai shoda koiramduna akoigi P3B amasung akoigi country akoigi state mioiba pumnamak sige COVID-19 pandemic staki pura pandemic se pura loiraga akoi we all be safe and sound and lead a life, and I hope the year the way we all faced the pandemic, we faced the hardships that we faced in the year 2020 doesn't ever come again. Thank you so much. Thank you so much for having me in this function.
Thank you, sir. Next, I humbly invite the chief guest of today's event, Sir Shri Nongthombam Biren Singh, Honorable Chief Minister of Manipur, to enlighten us with your valuable words. Please, sir.
Sri Sapam Ranjan, Honorable MLA, the advisor to CM Health, Chief Secretary, Additional Chief Secretary, in charge Health, the Director, Health Department, the Director JENIMS, the Director Family Welfare, the NSM, Mang Election Biriba, Health Department ki Maru Batho Biriba doctors, nurses, staff, the media friends, the invitees. I put on my kite no actually. Aina ngasi sidai dai kai gumakara isun mate kitang haininge Pithivi gi oina si girba mi si sige laina sina duk yame sathina yame aduga Bharat khata da lakh amaga lising yang khai ma thoi si koi Manipur da mi chahunga umphumangasi positive oibada India da crore maga lakh tara positive oi Prithvi oina hoji ha kar launai masida ina Honorable Prime Minister Narendra Modi ji ki magi vision Magi, I'm the first idea to aduga magi commitment BJP led government. Masiba udai koina appreciate to wahai dragade koi. Aduga handa ki COVID table ina si nara bhaudai koi si sense of humanity. Halatraba koi miui bida. Sense of COVID ina si na thengnari basigi matung dane koi se. Sense of humanity. Sanga da koina oliba nairiba maung sadana ima ipa da ahlamanda maung sadana oliba nairiba inhuman to action de koi realize to ngam jadra bako ai koi minatre na idi ai gi mon ne yung view ko sige laina se nung sigra nangi na puro ibase or ai gi nupi se or ai gi isa se or ai gi ima se Nare Sidori Kangabal Unawi Handabni. Please think. Can you? Shona equal the period Dundee Sikram than Makalgi Dundee noise. I get thinking me go. I quit Henman grave. Quit me with Henman grave. Be tripping upon the Tauri maps. Na Samudra the Level now to Saba the Sada Verkan de Canada, Spain, Belgium. Whole guy, but not so do Samuda do the Koi Tartar Chinkalaga, Lelaga, Ishing do the Torga Tauriba. Nepal Dina, Wayne Ubani. A quickie Sanje, Sabasunataba, Eroisi Dharmagine, Hama Halaganepura, Hampu Ogotamba. Example, I mean, I want the Pildo Unico. I don't know, Ataina Kari Kande, but I want the Pildo. Sinjaki with a chan and about Sabadukai Divo. Adusu. Nahan social media the ubani. Hamin do the Mahalaga Zaro area. Hamin do the Masuda social media the kin namuktin Kopano counter of Tagli. Just you imagine. Adu the Corona City, Corona Tamaiba Koi the Lainase. Nuksi Rabanangi, Nasanapi, do Unahandana, Namitagi Napita, Laknaraga Halini. Why? ꯑꯩꯈꯣꯏ ꯍꯦꯟꯃꯟꯈ꯭ꯔꯕꯅꯤ ꯑꯩꯈꯣꯏꯁꯦ ꯑꯩꯈꯣꯏ ꯃꯤꯑꯣꯏꯕꯁꯦ ꯁꯥ ꯉꯥꯗ ꯑꯩꯈꯣꯏꯅ ꯑꯍꯜ ꯂꯃꯟꯗ ꯊꯛꯁꯤ ꯀꯥꯏꯁꯤ ꯃꯦꯟꯃꯥꯟ ꯇꯥꯔꯛꯇꯕ ꯁꯤꯒꯤ ꯔꯤꯑꯦꯛꯁꯟꯅꯦꯅ ꯂꯧꯋꯦ ꯑꯩꯗꯤ ꯀꯣꯔꯣꯅꯥꯅ ꯅꯥꯗꯒꯤ ꯁꯔꯨꯛꯇꯤ ꯅ꯭ꯌꯨꯀ꯭ꯂꯤꯌꯔ ꯕꯣꯝ ꯀꯥꯏꯔꯒ ꯕꯪ ꯁꯤꯈꯤꯕꯅ ꯐꯕ ꯂꯩꯌꯦꯕ ꯃꯔꯝꯗꯤ ꯃꯗꯨ ꯑꯋꯥ ꯑꯅꯥ ꯀꯔꯤꯝ ꯈꯪꯗꯦꯕ ꯕꯠ ꯀꯣꯔꯣꯅꯥꯁꯤꯗ ꯑꯩꯈꯣꯏꯗ ꯇꯣꯔꯆꯔ ꯑꯃ ꯌꯥꯎꯔꯤꯕ ꯍ꯭ꯌꯨꯃꯟ ꯇꯣꯔꯆꯔ ꯑꯃ ꯌꯥꯎꯔꯤꯕ ꯂꯦꯁꯟ ꯑꯃꯈꯛ ꯇꯝꯕꯤꯔꯤꯕ ꯑꯩꯈꯣꯏꯗ 이마주 우는한 야들이 우나 세바 마콧 바이브 감드나 마콩 바이브 감드나 시비 아이 나리 강가서 아이 비도 아이 나트가 이 사도 이나가 장가가 세바 도금 감는다비 뭐 야우리 문나 칸비우고 문나 칸비우 아두가 시기 메시지 아이 마루이나 코이 머니푸르 아이가 사이라카나 아이가 시지 카주 텐슬레 파즈나 Honorable Prime Minister, मीवई करोड़ साम का कुंट्राल है भारत तक सुकुम बस 60 रब कोरोना वायरस मामा मापा बहुत उन्हन बयाद बस इधर की कमाई ने कन्वे द गेस है early stage की मामा सी उड़का दमाग वाक हो करे कोरोना नारे है वसी 30th March तक हैंगे बने but मधु की preventive टी 17 January दा हो करे अखोई मणिपुर 18 January दगे अखोई एयरपोर्ट अखोई केनो तो चेक तो होवे बगोय मयाम लाकपद स्क्रीनिंग तो होवे 18 January इमा मार्केट मार्च की तारीख कुन चलगा मार्च की तारीख कुन मंगा दगी थिंग होवे मणिपुर अखोई पॉपुलेशन का हरदी याम सठी न सोम बयाबनी मियोई लिसिंग निफु यांखैनी मपानदगी ट्रेन ने पोरख्रिबा मपानदो दा आदा साब फंग्रे अदुना अदु तौरेन लाउरगा कप्पक लाइरगा लगिबा मयाम निंगसिंगजे वी शुड नॉट फॉरगेट इजीली मधुगी मयाम दो ट्रेन द पोरंगनबा लांगनबा मतम द ट्रेन द जिरी द योरकान मधुगी बस तम पोरगा मयुम जगह जगह द चंगबा याददन थेंगनगिबा मधुगी मयाम था तरे निपान फ्री द मपान थोकबा यादबा युम द लेरकान मदि द चेंग फ्री द योलगा इंजांग फ्री द योलगा सब टोंग होना रखिबा मयाम भारत पुंबगी करोड़ चामो कुंट्रा मणिपुर की मियोई लाख कुंट्रा लाइन लोबिगनो कोरोना की हिदाक पुथोकांदा सोशल मीडिया दा करीमनरी सी कनानो मोई साइंटिस्ट रा मोई डॉक्टर रा था काबगी सारिबा दियाडोर न पुथोरकपा मेडिसिन दु और मधुगी मेचिन दो क्रिटिसाइज तौदोरिबा ऐसी कनानो आई अदा यावरुब्रो आई खंगुब्रो मधुगी मचामगी कंपोजिशन मचाम आई खंगब्राइबा बट फेसबुक से ते इबा यारे ने इबा यारब्रा ट्विटर से एक आई खुन्ना एक थाबा यारब्रा irresponsible तोइबा मतम संगना मसाई ऑनरेबल प्राइम मिनिस्टर ना हाइदुले लाकदबुदुगी जनवरी की तारीख 13 टाइम पांद कोई स्क्रीनिंग होरगसु मदुगी ममांग थामगे मांगदा हाई लेवल कमिटी सेमकांदा लाकदब पोसी उरकांदा मेडिसिन की प्रिपरेशन होनगरे मेड इन इंडिया दा हिदा पुथोइबसगी एप्रिसिएशन दो साइंटिस्ट मयाम न पुल्लगा डॉक्टर मयाम न पुल्लगा सही अम हेन चंगना रिसर्च तौरकांदा पुथोरइबा पोसी दा सोशल मीडिया दा फमुंग द हिप क्रिटिसाइज तौने न तौरिबसि I'm really surprised. अदो आईदी मसिगु मसि क्या टॉलरेट तौगंदे मिंगोंदा अकी अखंग पीरिबा साइंस ने प्रूफ तौरकांदा नहान प्राइम मिनिस्टर की कॉन्फ्रेंस फसन हाइग्रे बेंगोल की ममता चीफ मिनिस्टर ने हंगप क्वेश्चन नमदा साइंटिस्ट न फजना चीफ मिनिस्टर मयाम का प्राइम मिनिस्टर मयाम का साइंटिस्ट मयाम का रिएक्शन तौनबदुदा फुल प्रूफ repeatedly tested अदु इशूने तुम लेदर कोई साइंस ने प्रूफ तौरे डॉक्टर ने प्रूफ तौरे अमन ने प्रूफ तौरे अदु इशू लेदर रे कोई अदु देखो कमाई तौने अदुना रंजन ने खरा फागल होइग्रे मियोय बदा सिगी कैनोदा अखोगी नेशनल डिजास्टर्स मैनेजमेंट एक्ट की मखादा मिंगों द मसी रॉन्ग मैसेज संदोक यादे मिंगों द किहन बे यादे साइंटिफिकल प्रूफ लेरगदी यस मा ओपन डिबेट तो बे ओपन मदुदै मा हाइबे नतना भारत की सरकार साइंटिफिक रीजन यावना पृथ्वी की ओइना वर्ल्ड हेल्थ ऑर्गेनाइजेशन यारगा पिराबा पोटमा किहनबा नत्रगा नेगेटिव पीबा नत्रगा तौबसे मसे नेशनल डिजास्टर मैनेजमेंट एक्ट की मखादा they should be punished नत्रगा दे खोई से डॉक्टर सु ओइनी नर्स सु ओइनी ओजा सु ओइनी पुलिस सु ओइनी साइंटिस्ट सु ओइनी लोइना खोइना आइना ओइने मामा की प्रोफेशन दु कोई इकाई खुमना बथम दु मी खरगी वानी लोइना की नतिको अद मोय खर दुदी परा तंबी द बेरोय अन सिगी अखोई मणिपुर द एग्जांपल ओइसे अखोइना थेंगना किबदु अखोई मणिपुर खक्ता द अखोइना नैना से भारत के चौग्रब करोड़ मगा करोड़ चाम कुंठा से तो से मधुगी अखोइना लॉकडाउन टोटल लॉकडाउन तो मतम द मयाम वागिबा मयाम दो खंगनेबा प्रजा वाने से बट हिंदी द जान है जहान है अखोई जो पुंसी लेरदी खुदिमक ले हिंगदी खुदिमक लेबा हिंग सिबन मितु द लोइ लोइरे अदुना ओनली अखोई की प्रायोरिटी से लाइना सिना नाहंदबा लाइना सिना सिहंदबा हाइबा मिशन दु संगा कान मी अबगी लाइफ सिदं कल्लगा लोइरे न खोइ सत्किबने मधुना बुंगसी अखोई कंट्रोल ngam ine mother doctors sing logi role medical staff paramilitary staff medical staff sing lady sing logi role police security personnel sing logi role hoji akhoi gi ngasi principal secretary eno yaugdabani mang mayam gi honabadama corona naraga leire negative ori adu recover to bungam soli hosi mayam ma ju hosi face tori hosi keno gi rims ki director hosi message thare ma keno tore hida kape front line ta lairiba doctors sing nurses sing paramilitary medical staff sing hana priority people karigi fill the war fill the sangi sina koi ni mayam na khoi hana protect to dia de adugi poni aduna honorable prime minister na laura iba posi phagi nate miyoi karor chamuga kunthrabu pura lockdown torga yum da thamakanda laina asigi ngak thongnar bo hone kana madugi manage to kibudo seng piriba chana piriba injang piriba thakna bising piriba madugi thengna giba mayam adagi mapandagi लाइना अपनी पुसलकनो हाई मैम यावे अखोइदा ओ दिल्ली द कनो दो अखोगी कोविड याम नारे ये मफान द दुम लेजे सनो पुसलकिनो नांगै लाके हाइदर हुजिक दौ लाक्तोइनो न सो मेनी थिंग्स अदा अखोइदि इसानी ना उनि कंदबे यादे सोमदि इमुंग मनुंगिनदि आई इसा दो पुसन बिरो इसा दो आदा सिदारे बट गवर्नमेंट अखोइदि इसा जिंग नाउजि मयाम दो पुसलक्तबे यादे कंदबे यादे सिमिलरली भारत की चाइना मी चंग धर्मतम हुआन की अदुगी एरिया दगी फ्लाइट थारगा इंडिया में सा क्यानो लौथौरिबा कल्लुरिबा हाइबजे अखोइ सिदा पकने ना अखोइ मिदो आदम सिजरो सि यारो एबा अदा अखोइ मणिपुर जो थोकेबा अस्मिदा पुसलक्तर जो याबदो आदम राइ लेजेने सिगुम याम इनह्यूमन दुबा अदुना गवर्नमेंट अखोइना लौरइबा डिसीजन से ngasi honorable prime minister na matam chana decision lorum dagadi india na mi crore kya sirambi crore gi mathak sirambi but honorable prime minister na matam chana preventive measure lo hobuduna care to hobuduna ngasi india gi population yambai manung da america china india lore om jine atai di country mani haba ani missing ka suyam di अखोई इंडिया गुमना सुमायना सिगी लेवल सिदा कंट्रोल तो बंगम सि पृथ्वी लेबा पुनम थागने अदुई मथकता ख्वाइदगे अखोइना आइगी थमोइदगे आइना एप्रिशिएट तोंगिबदि इंडिया के साइंटिस्ट सिंग इंडिया के डॉक्टर्स सिंग इंडिया के रिसर्चर्स सिंग सही अमगी मनुंग सिदा मोइना वैक्सीन अनि पुथोकाना मेड इन इंडिया पुथोकाना इंटरनेशनली नॉर्म्स एक्सेप्टेंस बिरकाना vaccination ngasi dagi hobuse ai masigi dam tai honorable prime minister just from bottom of the heart party ki nate ama ki nate as a leader ai thagat tabungam de magi am the conviction leba am the committed to am the farsighted leba aduna ai khoi mi atai na ngang ra so professional leba no khoi di with conviction and confident praja bu kan gadam ne khoi praja kan bai da khoi gi thong mang na phambi riba doctor sil naw sing nurses ki sil naw sing para medical staff sing akhoi na khoi gi thabak di min ngang khang da sin ngang chino ngang chino hai chino maduna logi matung ina action lo ba yabna logi adu gi da mai tawgen but ai khoi na khoi gi di praja gi life kan ba karma laina dagi ngasai hai jebudo sometimes I am emotional way kari no kana ai gi nuksi graba isado na ba kan da manak sang bangam da badu makhal gi laina ne adu makhal gi laina ne adu sigi message si ai di pithibhi pamuda pihenningi yana inhuman gi lisat chaliba mi bu hekta mangaka ga haliba mi bu hekta taruga kapa ga haliba adagi sa bu hekta kenu da magi chincha ki nata bada hekta ot nei raga tauriba uwa jungle hekta mai thar ga manghan nen khaliba akhoi sugumba akhoi mioi bese masidai da lesson achauba mane na idi maseba masi agi masigi message akhoi mayam puna mangna I repeat again ang khan biu ne sum laina je kam kan thok thake narasu una ya da bi shirasu changbo ya da bi paibu ya da bi seba su tobu ya da bi sugum laina je kam kan thok thake mase ai gi mota dai mi ne ngau ni haigera hairoi ai di ishor na ikhoi se henman medigi jungle leite keno u khai lei dige busi sing da u hogu da bu sing da u khai lei dige na leibum kat pat ka dai lei dige sa leibum jungle krai lei dige loi na manghan bane koi na manghan limeus adu bi global warming ni lais ai koi na tog je potu ki phol ni koi da lai reactions aduna ai koi ngasi yam turning point amani prithvi gi oina india gi oina yam turning point amani haina loye gi motadi aduna honorable prime minister ma prithvi gi history da lai horoga da bodu gumba leader mani magi yam the first side doiba timely act ho buduna ngasi ekoi mayam casualty phangamba yaba sang du yog dune koi ngasi save toroga leini aduna hariba laina sidagi kan bai se koi yam tangai fodab nei ngai do etom bom ma taraga japan da sigi ba natraga xy de hiroshima da sigi bi khangau de ba bang sigi ga sa si akhoi da mioi bi chak podu pi de mioi ba ma da yam chakan ba yam na kaino to se pi de sa sigre but sigi laina si de ai amon repeat haris ai khoi da para ma tambira ko dong isona kainom to mase ai di minute by minute akoi intellectual circle sing kari mayam naina halaka na prithvi se yamna awon ba sanga sumai mayam phamda leijaba mi sumai mayam phamda leijaba ade akoi masen amaga paha ta hatong na bi pangtong do tong na bi pangang na ngang na bi masi mayam de to ga ba yamna peaceful humanity the base of prithvi ma humanity the base of du malai ba ma semo hai ba male gi motade aduna akoi madu hausi ai gi mote ai di akoi mingon da phataba to gumse mingon da torture to gumse mina yaning da badana fu to gumse adagi minung si leina asolana mateng pangsi mi bagi punsi hingminana bokona se kanana bokona se mi magi punsi mateng pangana bada ege angam mateng pangsi adumaina tawroga di corona gumba si lawi do malna tari corona gumba sati buse laki ga do male akoi mi bina phadra de ba aduna wafam khaji tamaga ai kitang asi se adum yamna nungai ba phasu phawi aduga akoi gi ꯑꯩꯈꯣꯏꯅ ꯇꯧꯔꯤꯕ ꯄꯣꯠꯁꯤꯗ ꯆꯨꯝꯊꯣꯛꯍꯟꯅꯤꯡꯕ ꯈꯔꯁꯨ ꯐꯥꯎꯏ ꯑꯗꯨꯒ ꯑꯩꯈꯣꯏꯅ ꯇꯧꯒꯗꯕ ꯊꯕꯛꯁꯦ ꯑꯩ ꯉꯁꯥꯏ ꯑꯩ ꯔꯤꯄꯤꯠ ꯑꯒꯦꯟ ꯑꯩꯈꯣꯏꯗꯤ ꯁꯤꯗ ꯂꯩꯔꯤꯕ ꯑꯩꯈꯣꯏꯗꯤ ꯃꯤꯒꯤ ꯄꯨꯟꯁꯤ ꯀꯟꯕ ꯍꯥꯏꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯏꯊꯧꯅꯤ ꯗꯣꯛꯇꯔꯒꯤ ꯄ꯭ꯔꯣꯐꯦꯁꯟꯗ ꯅꯔꯁꯀꯤ ꯄ꯭ꯔꯣꯐꯦꯁꯟꯗ ꯄꯦꯔꯥꯃꯦꯗꯤꯀꯦꯜ ꯁ꯭ꯇꯥꯐꯀꯤ ꯄ꯭ꯔꯣꯐꯦꯁꯟꯗ ꯑꯣꯔ ꯄꯨꯂꯤꯁ ꯐ꯭ꯔꯟꯠ ꯂꯥꯏꯟꯗ ꯂꯩꯔꯤꯕ ꯑꯩꯈꯣꯏꯒꯤ ꯗ꯭ꯌꯨꯇꯤꯗꯤ ꯃꯤꯑꯣꯏꯕꯒꯤ ꯄꯨꯟꯁꯤ ꯀꯟꯕ ꯃꯤꯑꯣꯏꯕꯒꯤ ꯁꯦꯕꯥ ꯇꯧꯕꯅꯤ ꯑꯗꯨꯅ ꯑꯗꯣꯝꯗ ꯌꯥꯝ ꯀꯟꯅ ꯃꯥꯏ ꯑꯣꯟꯁꯤꯜꯂꯒ ꯑꯩꯈꯣꯏ ꯍꯣꯠꯅꯁꯤ aduna sigi vaccine sigi maramda scientific yaudana negative comment bibigano scientific proof later, okay, you can challenge many forum later. Other natana social media, the karida, mother, mayam, the pulling hunter, negative way, a photo, Tovigano, kind of social media as if Hagi Wena, Shinavigano. See, I'm the Twitter, the high port official in a longer bunny. WhatsApp official in a longer bunny. Sigi port mayam, si mayam, social media, Pibi, Kangunasu, Kovigano, Yam the Madam Saba, with reason, with proof. Adum to we adu yaudo bada to we gano have a pump kasi tamaga nasidagi aikoi live train nasai principal canon health ki in charge no high gre matang health care singi kapa hora matung da atop round ma da sahi gi mai category matang leiraga to gre aduna loina Manipur da leiba miyam punama thungnana ba kapakani I na how mandana hidak thongam numitoi hidak thongrani haibagai airport stillagai man excitement duniko excitement aigi praja kanmungam godore haibagai haraugudo atai da kari feel to buno dikhangde but what I feel aigi praja kanmungam godore khoi notice khoi Manipur ni yana na hidaka thongre kai dugi nungai jebuduni ai airport stillaga receipt of jaruri to aduna ngasi shu hogdok bagi numit ai manga hujai ure kape matang sequence na anything hidang ni medically kari tholpa yai madugi timing pi gare minute kuntra observation da thamba kari tauba kai da hai da madudi medically ID doctor na tamina adu da khoi ne expert hoiti adu doctor na hai da ta doctor na tawri po to khoi ya bata aduna apung khrasi thamjaraga ai mayam punama Manipur gi mayam punama COVID hujik hanju handare COVID ngasi manga tarung ni isona sanbi dana misi mina yaudre si adum khara chamri ga tarakun leiri positive oiba masi si fagat piraga koi se COVID free oiba COVID laina asidagi free oiba misi mina leitaba awana leitaba dugumba state ma ohenbi ona isora ni jara ganai mayam khoram jare jai hind.
Thank you, sir. Also, very true, sir. 2020 was definitely difficult. COVID-19 has reshaped our world, and we do not yet know when this crisis will end. But with the launch of this magic bullet, we all hope for a better 2021. Thank you, sir, for your commendable leadership. Next, ladies and gentlemen, let us all keep our hands together as we welcome our dear director, Sir T.H. Bhimo Singh, onto the dais to deliver the vote of thanks. Please, sir.
First of all, good morning to all. Honorable Chief Minister of Manipur, Chief Guest of today's function, Dr. Sapam Ranjan, Honorable MLA and the Advisor to CM Health, and the Chief Secretary, Government of Manipur, Dr. Rajesh Kumar, Additional Chief Secretary, P. Wi-Fi, Amadi, Tinbiriba, all the invitees, Mayamge Ayaba, Lojaraga, I vote of thanks, organizing committee gi Taraptagi Ijage. On behalf of the organizer and also on behalf of JENIMS, I would like to thank Honorable Chief Minister of Manipur, President JENIMS Society, for his great leadership to manage COVID-19 in this state, bringing zero death in the last 10 days, at least in JENIMS. Sir, it is under your chairmanship of State COVID Consultative Committee with regular weekly discussion with all the administrators, experts, and the CSO leadership, which consists of Honorable Health Minister, representatives of MLA, Chief Secretary, DGP, Health Secretary, Director, Health Services, Director, RIMS, JENIMS, Director, SIJ Hospital, Director, Babina Diagnostics, and the State Economic Expert, Dr. Priyo Ranjan, that all the COVID problems were discussed one after another again and again with relevant problems to solve the matter. That is how we are able to bring the COVID management. I would like to mention the continuous efforts taken by all the honorable MLAs, DCs, Superintendent of Police, DMOs, District Surveillance Officers of the state, media personnel, right from reaching IMPHAL Airport, Jiribam Railway Station, up to the community care centers, and finally up to the COVID hospital at RIMS and the JENIMS. Once again, on behalf of the organizers, I thank all of them. Next, on behalf of the organizers, I also thank Director Health Services, Dr. K. Rajo, Director Family Welfare, Director National Health Mission, Director RIMS, Director Fire Brigade, Director Forest and Environment, all the DMOs and the DSOs and their whole team of staffs for all the cooperation and the timely help given to the needs of the patient management of COVID wards. And my special thanks to the Director, State Health Mission, Dr. Shamjai, for visiting repeatedly under the instruction of ACS Sir P. Wi-Fi to make this function successful. One of the basic control measures is implementation of SOP for the COVID. In this regard, on behalf of the organizers, I also thank the State DGP, Sir L.M. Khaute, all the DCs, all the Superintendent of Police of all the districts, and all their team who are still working to maintain SOP for the last 10 months. Next, JENIMS has been earmarked to run COVID-dedicated block with 155 beds, including 14 ICU beds, 20 gynae beds, and 1 operation theater under the guidance and the supervision of Principal Secretary Health, Sir Bhulumang. Recently, another dedicated COVID hospital was also launched on 10th of December 2020 by Honorable Chief Minister, including 10 ICU beds. So far, we have admitted 1,420 COVID patients till 15th of January. And out of this, 1,151 has been recovered. Unfortunately, we lost 138 patients. But on the other hand, it is worth mentioning that out of the 111 COVID pregnant ladies who were treated in COVID-2 JENIMS, 59 had normal vaginal delivery and the 52 had undergone lower segment cesarean section. But with the blessings of God, none of the COVID pregnant mothers died. For these all efforts, I thank all the healthcare personnel of JENIMS and the Dental College JENIMS, consultants, senior residents, postgraduate students, junior residents, internists, students, nurses, technicians working both in COVID and the non-COVID areas of JENIMS for their sincere and dedicated service in the last 10 months. I would also like to thank Nodal Officer BRDL JENIMS, Dr. R.K. Manos, Biotechnology Department, Manipur University, and the IBSD Tagyalpat, and their whole team who have worked even 12 to 16 hours a day in the beginning of testing in cases of all needs under all sorts of pressures. In the last 10 months, we have tested so far 97,324 samples. Out of this, 9,510 were positive till 15th of this month. In this regard, I also thank ICMR for supply of necessary RT-PCR kits and the equipments to BRDL, RIMS, and the JENIMS through State Health Mission. My special thanks to the biomedical waste team, sweepers, helpers of JENIMS for their continuous efforts for cleaning and the proper disposal of COVID waste products from the COVID ward of JENIMS for the last 10 months. Lastly, I thank media personnel, including print and electronic media, for their great role right from 23rd March 2020, when first COVID case was admitted in JENIMS till today. It is the golden words of All India Radio, DDK IMPHAL, and the local TV channels to wear masks, maintain 3 feet distance, hand washing frequently with soaps are still the best preventive measures of COVID, in addition to COVID vaccines, which is launching today. Let us unite and fight COVID together and defeat COVID. Jai Hind. Thank you all. Namaskar.
Thank you, sir. I now take the liberty to invite all of you for a light refreshment session right behind the hall. Thank you.